Our next presenter is Dr. Anil Muniyappa. He's a head healthcare transformation Cloud4C. But before his presentation, we would run a video, and Cloud4C, all of you would be aware, is one of the solution providers, and it's one of the largest data center providers in the country and in the whole region. And on the healthcare front, they have an interesting concept of healthcare in a box solution. So I'm sure Dr. Anil would throw some light on that. But before that, let's have the video, and then we will have Dr. Anil's session. Thank you.
अरे शर्मा जी, बिलिंग मैनेजर क्यों फोन कर रहा है मुझे बार बार? क्या किया आपने?
मैम, आज HIS डाउन हो गया है, इधर हॉस्पिटल में पूरा बवाल मचा हुआ है।
HIS वालों को फोन करिए ना आप।
मैम, एप्लीकेशन HIS एप्लीकेशन ठीक है, इंफ्रा में गड़बड़ है।
तो पूरा फिनेंस, अटेंडेंस, वेबसाइट, चैटबॉट, पेरोल सब डाउन है क्या?
मैम, सब अलग अलग सर्वर में है, थोड़ा इन्वेस्टिगेट करने में टाइम लगेगा। आप 2 घंटे दो, मैं आपको वापस फोन करता हूँ।
अरे यार, समझा करो, CEO सर भी फोन कर रहे हैं बार बार, मेरी नौकरी खाएंगे क्या?
मैम एक और प्रॉब्लम है, पेशेंट पोर्टल भी हैक हो गया है लग रहा है।
सत्यानाश, आप फोन रखो, मैं आ रही हूँ।
How many of us here actually resonate with what you actually heard, right? If you're actually from the hospital background and running in IT, right? Most of you would actually correlate to what we are trying to talk here, right? I have 2 different set of slides with me. It depends on how you interact with me. If you are more interactive with me, I would keep it very, very crisp, and finish it in 6-slider. Or I have another deck which will take on for next 20 minutes, and I'll be the one who will be between your lunch and me, right? Thank you. Thanks a lot for all your time. Thanks a lot, Gopi. Thanks a lot, APAC News Network, for giving us an opportunity to present what we feel is the right thing to do in healthcare, right? Myself, I'm Dr. Anil. I'm a trained clinician by education and into healthcare IT from past 20 years. I worked in multiple companies and developed HIS, hospital information system, telemedicine, and multiple systems across in multiple countries. And currently I serve as Vice President handling the healthcare vertical in Cloud4C. I have only 4 slides here, right? Are you all with me? No, I still don't hear it. Move it on to 20-slider one, right? So I'll just present 4 slides which should make you understand what we are, right? Who we are, why are we trying to do this, and what we do, and what next, right? So this first slide is on who we are. Cloud4C is a multi-cloud application focused, application focused managed service partner for mission critical applications. We have more than 4,000 plus enterprise customers. We are the largest SAP premium supplier. We have 400 plus SAP RISE and SAP HEC customers across. We have a very good CSAT survey of 4.4 out of 5, right? We not only do this, but we also do an implementation of SAP ERP implementation as well. We have vertical specific offerings being specific to industries that we serve, like your banking sector, like your healthcare, multiple verticals that we target. We have a global footprint of 26 countries. We are there in 26 countries, and we work out of 52 different locations across. We are headquartered in Singapore, but the nerve center is definitely in Hyderabad, India. We have more than 2,000 plus employees. What we have actually specialized in is providing a single SLA on the application layer front. We have achieved more than 99.99% application uptime, right? Looking at all of our achievements, rightly so, Gartner actually recognized us as a visionary, and we work with multiple clouds. The reason why we are able to work with multiple clouds is because 2,000 of our team members, they have multiple processes that they need to follow, and most of them are actually certified in Azure, Google Cloud, AWS, Oracle, SAP, and the likes of it, right? And this special engagement that we are having on healthcare is with AWS, right? I'll take you through the next slide. Why we do? I mean, what are we trying to do this, right? You will also be able to appreciate. Okay. These are the healthcare IT challenges, right? Whether you like it or not, these are the common healthcare IT challenges that we face. IT is usually not viewed as a core competency by the hospitals, right? And you have multiple systems which are running. You have a different system for PACS, you have a different system for HS, a different system for payroll and whatnot, right? And all of them come with high upfront costs. Since you have multiple systems, you will have definitely multiple vendors. And you're into more trouble if you are actually keeping all of these applications in-house on-premise, right? Because you have to handle multiple servers as such. And most of these applications that you have are actually not integrated to its fullest capabilities. Am I with you all still? Or let's go to lunch. So it's not integrated to its fullest capabilities as such. In case you want to bring in an innovation within your hospital, like you want to change your registration process or the way you would like to do while you were in COVID era, right? In case you want to bring in an innovation, it takes a lot of investment since you have multiple vendors to innovate and come out with something new. And then each of them have taken a longer implementation cycle for you to implement. That's one of the main reasons why you don't want to move away from that and go to another system, right? And I have this term known as cyberochondria. Nowadays, patients, right? They know about the disease, right? They Google, they find out, they know about the disease, they know about the treatment, and they come to you to actually tell you, okay, give me treatment A, B, and C. These patients are known as cyberochondriac. It becomes imperative for the hospitals to actually, right, to actually give them a digital health journey as such. They want online appointments, they want to see all their lab reports, right, on WhatsApp. All of this is become imperative for the hospitals to bring in. Interoperability is not addressed. Like, I have NHA counter there, it needs to be integrated with ABA. How are you going to integrate it? Unless and until you have systems which are actually ready to talk to, right? These are the usual healthcare IT challenges that we face. Do we all agree on this? Or are there more? Agree? So what we did was, we took the best of the breed products in the market, put it over a cloud, integrated it, tested it, and brought it to the market, right? These are the multiple applications. Gone are the days when people used to think that, oh, yeah, I have a HMIS or a HIS, it runs. No. You need to have multiple other applications which are catering to the need of the patients in providing quality care, right? So HMS is a core part of it. I'm sure all of you know about HMS. It has multiple modules, revenue, clinical, admin modules, 27. And then we also have a patient portal, which is very, very independent of any HIS that you run, right? So this can have the, your patient can actually log in, get to know the entire information about his lab reports, appointments, EMR, all of that, patient portal. Again, all the products that we have brought in are actually integrated or certified by ABDM. And we have done the sandbox testing from the cloud to the sandbox, and we are there to the personal health record of ABA, right? Then we have also brought in a drip monitoring application. Drip monitoring application, this is one of the connected care themes that I want to touch upon. The patient is actually in the ward and the patient is all alone. Sorry. I'll finish and come back. Audio is not coming in. After this? Sure. And then we have brought in a drip monitoring application, right? Wherein, in case if there is an occlusion which is happening and the drip is not flowing through, how do you communicate this to the nursing staff there, right? That's a huge problem that we usually face. So we have brought in a specific app to solve specific problems within the healthcare environment, and one of them is drip monitoring. The other thing that we have also brought is a very intuitive chatbot. Chatbot, when it can be on your WhatsApp or it can be on a website, right? So that again integrates with your existing system as such. Why do we stress upon integration? Is that because we have provided an integration service integration layer as a service, which is again based on HL7 and FHIR, right? So any existing applications that you have, you can pick and choose any of these applications and then it starts working, right? So we take the responsibility of doing that. We also have brought in a clinical governance. What do I mean by clinical governance? You've all heard about NABH, right? NABH has multiple quality standards that you need to be adhered to. And if you leave it upon the quality department to do it, it's a tough task, right? So what we did was we split the entire NABH into multiple chapters, brought down to tasks, so that all the quality staff actually know what they need to do on a daily basis and prepare and keep all your documentations ready when your NABH assessor comes into your hospital. Okay, that's another one. Then we have healthcare analytics. Analytics, we have our own COE, Center of Excellence, where independent of your existing systems, we get in your hospital, understand your requirements of analytics, come out with your analytics solutions. Because 20 years, trust me, no two hospitals agree on what you really want to see on a dashboard, right? So that's what we do. We have also brought in an RIS and a PACS. I'm sure you all know about it. But what we have done here is that on an existing HIS or existing PACS, we have brought in an AI for diagnostics, where it automatically detects certain diseases while you're actually processing those images. Then, myself, I don't know, I might have trained more than 1,000 doctors. Out of your hospitals, say 100 doctors, 60 of them might actually start using the system, right? Not more than 60 of them, right? Another 40 would definitely not like to come out of their pen and paper concept, right? I'm sure you might all have faced this challenge, right? Now, would it be fair or would it be actually digital journey in case if we exclude them? No. So what we brought in is another innovation with our partners, wherein we have brought in simple pen and a paper, right? You write the prescription as you write, but biggest advantage is that the digital data that is there, like your orders, are automatically transmitted back to your HIS. It goes to your billing, it goes to your lab, it goes to your radiology. So this is another solution that we have brought in. Telemedicine, yes, everyone spoke about telemedicine during COVID, but I'll tell you a trick, what happened to private hospitals, right? They started losing their own patients. The patient who used to consult, say, Anil Hospital started talking to consultant from say Sunil Hospitals, just to give an example, right? So now hospitals started to think, I'm losing money here. So what they wanted was to have a telemedicine application with their own doctors for their own patients, integrated with EMR and integrating with billing systems, right? So that's what we brought in as telemedicine. And of course, teleradiology. And we have also brought in an eICU, right? During COVID times, right? Intensivists and anesthetists, right? It is very difficult for them to go to and meet up in your ICUs, right? So what we did was, we integrated the monitoring devices, your ventilators, and have a central dashboard for them to see and automate your entire ICU, okay? And how do we do this? We put all of them over cloud, and there are certain government standards that we need to adhere to whenever you're putting any data on cloud, right? So it has to be MATI empaneled, right? And these are the different ISO standards. It has to be A, B, C. People sometimes also tell, I want HIPAA, right? Yes, we are HIPAA compliant. In fact, we did another project in Canada, which is PIPIDA, which is HIPAA plus, right? So we take into consideration all these standards and bring in. For the healthcare, we consider these as non-core apps, right? Finance, CRM, employee performance management, enterprise performance management, specific to healthcare, right? And we have our own team, as I mentioned, on SAP. We come down, we understand your requirements, deploy SAP, train you, and move on. So this is what we do, known as HIB. Other than this, we also have a remote monitoring services. Under that, remote drip monitoring is one of them. We also have a remote diabetes monitoring. Why should a chronic diabetic patient come and meet up with doctor, say, sorry, I'll move on. So these are the different services that we offer.
We started our
just
digital
let you
journey.
hear about this.
That is to say that, what was once a closed systems of record, we were actually beginning to open up that, for patient access, patient experience, and so on. Growth was an important agenda. And in our case, healthcare facilities, we were, beginning to expand geographically, take on more and more O&M, operations and management responsibilities, which means we needed a trustworthy, a scalable, robust platform on which these new businesses can be onboarded. The ongoing and continuous consistent patient care, right, with good systems being put in front of the physicians and clinical caregivers, we wanted to ensure that the EMR helped them in their caregiving activities. Now, additionally, we knew that we were sitting on huge amounts of very valuable data for a number of years. Now, we had not necessarily leveraged it, right? And cloud really helped us unlock the value of data. Now, Cloud4C clearly was a very, very significant and a critical partner in this journey. We continue to work with them as our cloud managed services provider. They were already present in the region. They had huge experience in dealing with cloud transformation as well as ongoing management projects in the region for customers in the UAE. So that was a big plus, and they have very good processes, people, training, that goes along with the managed services provider. They helped us design the landing zone on the cloud, for the migration of this EMR system.
Thank you. That's the success story of Bujil Holdings. They actually
Are Sharma ji.
Sorry, Sharma ji वापस आ गए, right? So they actually run more than 16 hospitals in Middle East. They have most of them are JCI accredited and 1,600 beds. So that's one of the success stories that I wanted you to listen to. And you have any more queries, you want to work with us, you want to talk to us, we're all there. Cloud4C, we have a wonderful booth there. Please come, meet us. Thanks a lot. Thanks a lot for your time.
Thanks, Dr. Anil. May I request you to just come on stage for a minute? And may I request Shobhik to just hand over a token of appreciation to Dr. Anil. Thank you.